Hi, everybody. My name is Gemma Delgaudio. I'm the Director of Marketing at Perfect Teeth, and I am so excited today to be at the Perfect Teeth Specialty Center with Dr. Kerri Lawlor. She is the endodontist here. Hi, Kerri. How are you?
I'm great. Thank you for having me.
Of course. We wanted to talk today. We've been speaking this morning about some of the fears of root canals, and we want to set the record straight today that no fear should be needed. We know that not many things are as painful as a toothache, so we know that the pain can help alleviate it. So when the nerve of the tooth gets damaged and it becomes infected, you need to know, and you need to go and see an endodontist, and that is you. And we want to know, our listeners want to know a little bit about you and how you got into the field. What excited you about teeth originally, and then how did you get into being an endodontist?
Well, I worked for a dentist in college, my freshman and sophomore year, and that's how I became interested in dentistry. I started at the front desk part-time and then started to help out in the back, assisting, and went to dental school right after college. I was a general dentist for about 8 years before I honed in on this specialty and decided this is where I really wanted to, where my interest really lied, and went back to school to specialize, sold my practice, and went back to school and specialized in endodontics.
That's awesome. So an array of specialty, including general dentistry, which is pretty neat. So we know that there is that stigma around having a root canal. There can be some fear around that. So what, in your opinion or in your expertise, can you tell us what causes a tooth to need endodontic treatment?
Well, I'll emphasize that most of the fear when people talk about a root canal or having pain around a root canal is the pain beforehand. And because toothache pain can be very intense, it's one of the most intense pains that we can experience in our body. The mouth is a really sensitive area. So a lot of times when I have patients come in who've never had a root canal and they talk about the pain ahead of time, I reassure them that it's typically not the treatment. It's typically the pain that is the cause for the need for treatment. The treatment itself should not be painful. So the reasons can vary. The most common is having a deep cavity, deep decay, or a deep filling that had to be placed to repair deep decay. And sometimes that can be right away, and sometimes that can be a filling that was placed years prior, but that was deep at the time. And all of those things, cycling through with hot and cold and biting and chewing and using our teeth every day, clenching and grinding, can lead to the nerve tissue becoming damaged and needing to be removed from the inside part of the tooth. Trauma is another reason as well. So those are the two most common that I see. Trauma, where the teeth are actually banged or undergo a force, or deep cavities, deep fillings, dental work.
So do you see a lot of athletes if there is trauma?
We do see a fair amount of athletes. Wear your night guard if you have kids, or their mouth guard. Have them wear their mouth guards for sure. And some traumas are mild, and root canals are not always needed in that case, but it's always a good idea with any kind of trauma to have it checked out, evaluated. We can kind of track it over time and make sure that the nerve doesn't undergo damage that needs to be addressed.
So as a leader in the field, how many appointments typically would you say someone will need if they require endodontic treatment? Is it multiple visits to you, or are we looking at, inspection afterwards to make sure everything's okay?
Most of the time, we do our root canal treatments in one visit, and I would say that's about 90 to 95% of the time. There are cases where root canals need to be redone or re-cleaned. Sometimes those require more than one appointment. Trauma cases can often require more than one appointment, not necessarily for work, but to monitor and follow up and make sure that things are healing the way that they should. So there are times when we do require more than one appointment. Sometimes the canal anatomy can be really difficult. You can have some curvature in the roots or the spaces, and that can sometimes cause us to need 2 appointments to do the work. So we always let patients know if we run into something, a complication like that, you will be feeling better, but we may need to medicate the space and then have you come back another appointment to finish it.
Wow, that's convenient. Okay, big question. Which teeth do you see the most root canals on, and why do you think that they're the most common?
Well, I would say that we, as endodontists, as the specialists, the most that we see are molars, and that's because most of the root canal treatments in this country are performed by general dentists. And some general dentists do a lot of root canals, some don't do any. It all depends on their comfort level and their training skills. But the anterior teeth, more toward the front of the mouth, tend to be a little bit more straightforward in anatomy. So the ones I perform the most are on molar teeth. As far as which teeth end up needing it the most, I would say the molars tend to end up needing it the most because of cavities that tend to form on the back teeth. As far as trauma goes, it's the front teeth.
Okay, so we should not be afraid to come and see you, right, Dr. Kerri?
Absolutely not. Absolutely not.
Okay, so we are so blessed to have Dr. Kerri here with us today. She is based out of the Perfect Teeth Specialty Center, which is off of Colorado Boulevard in Denver. Please come and see her for a consultation if you need a root canal. She is wonderful. She is wonderful with patients, conveniently located, great hours with the specialty center. Please come and visit us. Thank you, Dr. Kerri, for today, and we look forward to seeing many, many more and helping many more people in the Colorado community.
Thank you so much for having me.
Thank you, guys.